Topping today's health news, researchers with the University of Miami Miller School of Medicine are looking at a new way for preventing and treating heart failure. Local 10 medical specialist Christy Kruger has details in our HealthCast.
The study, currently in its very initial phase, is looking at what causes the heart to become diseased in the first place. Dr. Michael Kapeloff and his team at have recently discovered a rare set of proteins inside the heart muscle cells that play a major role in heart disease. As a potential therapy, Dr. Kapeloff plans to test a drug that actually targets those exact proteins.
We're finding that by going after these effector molecules, the ones that actually cause the troubles in disease, as opposed to going after the global regulators. And in fact, we're getting tremendous efficacy without the side effects that would happen.
The doctor's research could ultimately lead to a new class of drugs to treat heart disease as well as heart failure. And people who undergo heart surgery or perhaps suffer a cardiac event are typically prescribed cardiac rehabilitation programs as part of their recovery process. However, less than 13% of those who should participate actually do. Cardiologists say that is really a serious problem because cardiac rehab is one of the best things heart patients can do to improve their odds of survival as well as their quality of life.
It's really crucial because it's not just about exercise, it's about learning how to eat, learning to stop smoking, controlling your stress factors. It's really a crucial part of having a healthy life after your heart event.
The doctor also recommends making regular physical activity a lifelong habit by exercising 3 to 5 times a week after cardiac rehab is complete. And that's today's HealthCast.